This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Well, we all know that men and women are not created equally, especially when it comes to health, and that includes your eyes.
Yeah, according to the American Academy of Ophthalmology, twice as many women suffer from macular degeneration as men. The statistics are similar for cataracts, so why is it? Well, we went to Chesapeake Eye Center to find out.
Dr. Todd Bezak of Chesapeake Eye Center treats each eye exam the same, no matter if his patient is male or female, young or old.
However, I may be keyed in on the history by different things in the patient's history, family history of certain medical issues or certain eye issues, certainly the age of the patient as the patients get older.
But that doesn't mean all eyes, male or female, are the same, especially when it comes to eye diseases.
Women get macular degeneration. Approximately 6% of women will get macular degeneration as opposed to only 3% of men.
Dr. Bezak says while it seems like a gender inequality, it really boils down to age.
Macular degeneration is almost completely associated with the age of the patient. The older you are, the more common you are to get it. It's pretty common knowledge that women live longer than men, on average about 5 years longer. And it doesn't sound like a big period of time, but those 5 years can account for macular degeneration, first of all, coming to fruition and also worsening upon, initial diagnosis.
Other eye problems do discriminate. Dr. Bezak says approximately 4 out of 5 cases of autoimmune diseases occur in women, specifically multiple sclerosis, scleroderma, rheumatoid arthritis, and Sjogren's syndrome.
The way autoimmune disorders work is your own immune system begins to attack your own body. So instead of fighting a disease or an illness that's going on, it attacks the natural organs that are not in a disease process, which can be obviously very troubling. Specifically, when it comes to the eyes, it can affect the dry eye syndrome.
Multiple sclerosis can attack the optic nerve, creating a condition called optic neuritis.
The optic nerve can become inflamed because of these autoimmune factors fighting against the optic nerve, which can result in a loss of peripheral vision or an enlarged blind spot.
Dr. Bezak says it's important for patients with these diseases, male or female, to have their eyes checked regularly.
Peripheral vision is something that we don't think about all the time. If I'm looking at you in the face, or I'm reading a book or watching television and I lost that central vision, I would know right away that I lost it. But if you lose a few degrees of peripheral vision, you might not know about it until it's too late.
Another disadvantage women have when it comes to their eyes has to do with hormones.
The producers of the tears are fostered better through the course of a life of a male than a female.
Dr. Bezak says more women suffer from what's called dry eyes because of their lack of testosterone. The hormone prominent in men actually protects the glands responsible for secreting tears. And speaking of hormones, birth control pills can play a role in development of glaucoma.
Birth control pills are designed to lower the amount of estrogen in a woman's body throughout her cycle. Interestingly enough, there seems to be a link between estrogen levels and protection of the optic nerve. The optic nerve is what specifically can be affected in glaucoma. This is more of a cumulative effect over someone's life that they've had less estrogen in certain periods that could lead to the potential for glaucoma.
But Dr. Bezak adds it doesn't mean women should avoid the pills.
Unless there's a family history of glaucoma specifically or high intraocular pressures in the eye for any reason that's been picked up, maybe specifically at that time it's not super important, but anyone who's been on them for a period of years should be checked.
Bottom line, make an eye exam a regular part of your life, no matter if you're male, female, young, or old.
And Dr. Bezak says hormonal changes in women caused by pregnancy, use of oral contraceptive, and menopause can also cause dry eyes. And if you would like to learn more about these conditions or read about the services offered by Chesapeake Eye Center, log on to our website, delmarvalife.com, and click on the Show tab.
I've never really had major visual problems.
Yeah?
It's difficult to imagine what that would be like. Imagine breaking your eye socket, cutting your eyebrow open, maybe even breaking your nose. It did happen to this woman, all while practicing for the sport she loved. Up next on Delmarva Life, we're going to learn more about her comeback and get her take on the upcoming Winter Games.
And while we're talking games, it's not a proper football party without a smorgasbord of snacks, dips, and finger foods. Later, we're in the kitchen with the Spuma, whipping up a couple of snacks that would be perfect for the game this weekend.
But first, we just learned about women's eye health, something many women and men are concerned about. Aging. Dr. Oz has more on how we can hang on to that fountain of youth.
Hi, I'm Dr. Oz. We can't turn back the clock, but non-invasive cosmetic surgery treatments can make it look that way. Ultrasound can tighten and lift the skin. Lasers can help reduce sun damage and bags under your eyes without undergoing the knife. And Botox and facial fillers help smooth out and fill in wrinkles.